Imagine waking up every day to a world where simply remembering important information feels like an uphill battle. Picture struggling to maintain focus on important tasks, constantly battling distractions that seem to pull you away from what's important. This is the reality for many people living with cognitive deficits associated with mental ill health and neurological conditions. These deficits comprise a wide range of cognitive functions, including attention, processing speed, memory, and executive functions. Someone affected by these deficits could be a stroke survivor or someone who has experienced traumatic brain injury. But it could also be an individual struggling with depression or anxiety or post-traumatic stress disorder. These cognitive deficits aren't just inconveniences, they are barriers to a fulfilling life. Quality of life is profoundly affected by these cognitive deficits. From struggling to complete tasks to strained social interactions, people with deficits in executive functions find decision-making and problem-solving particularly challenging. Returning to work often symbolizes a crucial milestone in the journey of recovery. Yet half of those who've experienced brain bleeding find themselves unable to resume their previous type of work due to difficulties with language, executive functions and memory. The current issue is that treatments to improve cognitive functions do not work for everyone. But we don't know yet who will benefit from a specific treatment and who won't. Ideally, we would like to have a predictor, a biomarker, that can tell a clinician which treatment would work for a specific patient. With our current research, we're trying to move further along the lines of more personalized treatment options. In individuals with psychosis, we are measuring neurochemical levels in the brain while the person is engaging in a cognitive task. For this, patients will go into an MRI scanner so that we can do MR spectroscopy. This will reveal the neurochemical levels in the brain related to various neurotransmitters. But recent research has also shown that neurochemical shifts during a cognitive task can vary a lot from one person to the next. This might explain why not everyone shows the same response to treatments. These treatments could either involve medication aiming to change neurotransmitter levels or more targeted interventions like brain stimulation. In the future, these methods could be applied to mental health conditions, but also to neurological patients. This is where the National Rehabilitation Centre can really help us accelerate our research. At the NRC, we can directly work with individuals who have experienced trauma to further explore these inter-individual differences and tailor the treatments to the individual. By working with a larger range of patients with different neurological and mental health conditions, we will be able to adapt and refine our methods, aiming to find the right treatment plan for everyone. I think my motivation is to really push this field forward, working on cognitive treatments, cognitive assessments, and really helping people to find the right treatment in the future.